So good morning guys. Today we have a short discussion on UTI in children. UTI, the most common age group in which UTI is seen is infancy, that is less than 1 year. And 3 to 10% is seen in girls and 1 to 3% is seen in boys. And in more than 5 years, febrile UTI is in 8%, febrile UTI 8 and febrile 7%. And we move on to gender predilection. Usually we have studied that UTI is more common in females more than males. But coming to neonates, the UTI is more common in males compared to females. Because the reason, because neonates, the most common mechanism of UTI is the hematogenous infection. But later, after post-infancy, females more than males, and in infancy also females more than males, because there is ascending infection, and in females the urethra is shorter compared to males. Only in neonates males more than females. Okay. And moving on to microbiology of UTI, most common is E. coli, the others is Klebsiella, Proteus, Enterococcus, Pseudomonas, and immunocompromised, as we all know, Candida albicans. And the risk factor for recurrent UTI, the most common risk factor is vesico-urethral reflux. It is the most common risk factor for recurrent UTI. And female gender is a risk factor, age less than 6 months, labral adhesion, constipation, immunocompromised and uncircumscribed males, they are all the risk factors for recurrent UTI. Pathogenesis of UTI can be ascending infection or hematogenous infection. As already we know, in neonates usually it is hematogenous infection. Later it is ascending infection. Therefore it is most common in females due to shorter urethra. Next is steps in E. coli UTI. E. coli from the colonic flora will colonize the perineum and will move to urethra, to urinary tract and to bladder. And the steps are, in step 1, the bacteria attach to mannose receptor on the umbrella cells of the urinary bladder. This bacteria is internalized, forming intracellular bacterial communities. Some bacteria forms filamentous form. Most of the intracellular bacterial communities are shed off as body's defense, but some intracellular bacterial communities and filamentous cells escape into urine. These filamentous cells evade killing by WBC. Others from internalized bacterial communities enter into cells of bladder wall to form quiescent intracellular reservoirs. So these filamentous cells will cause UTI, and this QIR cause recurrent UTI, act as a source of recurrent UTI. Thank you.